Hi, Diana. Thanks for doing this with me. Not Nosy, Just Curious podcast. And today we're going to talk about menopause.
Hi. I've missed you
I missed
since
you
our
too,
our
man.
last time.
Oh, man, it's been a long time. You were missed. Do you want to just briefly introduce yourself?
Sure. My name is Diana Adams. I'm the owner and founder of Glow Aesthetics Medical Spa and Wellness in Rochester, Michigan. I've been a nurse for 30 years and done everything from ER, OB, hospice to teaching nursing for 18 years. And now I'm in this space for 12 years, and it's very empowering because I'm able
Nice.
to help women. So here
And
we
is
are.
that important, helping women?
It's really important. It's really important not only to help them aesthetically, but to help them with their confidence, their aesthetic, but also their health. And that's really, really entering the space of aesthetics, which is cool.
That's great. I
Hmm.
agree. And do you think we're going to talk about menopause today? Do you think talking about menopause is empowering? Do you think women just kind of never talk about it, put it away? I mean, we all do it. It's not a secret.
Yeah, I mean, so menopause is something that's just not, it just doesn't end. It just doesn't just one day, it's over. I think it's a lifetime of hormonal shifts from the time we're born. It really is. But menopause can start as soon as in your 30s, like perimenopause, and you can perimenopause as soon as that and go through your 40s, and and then you menopausal, you've stopped your period, and now we got to wait 2 years to call you postmenopausal. So there's a lot of things happening, and everybody is super unique too for to the process. It's not a cookie cutter thing that we can just fix.
But don't you think, Diana, doctors are very cavalier about menopause? Oh, you're in menopause, and they fail to tell you the mounds and mounds of biological things that go on with this. If you don't talk to your buddies and you don't celebrate this instead of commiserate, you don't know that you're getting headaches all the time because of menopause. You know what I'm saying?
Right, but even before, like I can use myself as an example. I think hormonal issues, if you will, probably started to arise in my early teens without even
Really?
knowing it.
Right, right.
And that's why I say this is a lifetime process that we need. It's not just about menopause, but to go back to what you're talking about, yeah, we're in a different generation and we need to celebrate because I've got some exciting news. Yes, we've been ignored. I've been ignored. I'm 53 years old. My dear OBGYN, who is my friend, worked with him for many years, told me to white knuckle it and just start running.
Oh, okay. And,
Okay.
and it'll go away or
And I love him. However, that was when I was in my perimet. I was just really uncomfortable, getting heavy and just not feeling well, sleeping, hot flashes, bloated, the whole thing.
but that's the point though, Diana. All of
Hmm.
those things you said, they don't tell you. They simply say, well, you're postmenopause or you're in menopause. And like you said, the dictionary definition is your cycle ends. But they don't tell you your hair might fall out, you get bloated. I mean, there's a multitudes of things that could possibly happen.
There is, and to the defense of my OBGYN, he's there for women's health and babies, and the FDA guided the medical world really wrong for women, and that's why I say it's time to celebrate. My mother was put on HRT back in I think it was the 90s, right? Or close to the 2000s, around that time. And then she felt so much better with that replacement. And then all of a sudden, all those scares came out with
Hmm.
breast cancer and blood clots,
Right.
and it just keeps going on and on. And she was pulled off them immediately and had to white knuckle it. She's 81 now, and that my dear mother's still doing this and having hot flashes. So we're not there yet, but we're getting there. What's exciting about this generation is if you look into the news and you look into the FDA, they just took away a big black box warning for women in HRT. So we're now being studied.
Oh, okay.
They're now trying to create a program for women that is dose appropriate, because prior to that, doctors couldn't write a script at the male dose for women. It was too much. So this is exciting, but
Yeah.
you have to find the right provider. Like my women's health physician is not the right provider for this topic. So someone who specializes in it, I think, is where we're going.
Okay, Diana, just for, clarity, what is RHT? Replacement?
HRT, hormone replacement therapy.
Okay. And
Hmm.
like you said, my generation, we were not encouraged to
No,
take the hormones.
you were scared off of it.
Yes.
You were going to get
Yes.
breast cancer and
Right.
the whole thing. And now the studies are reversing, and not reversing, but there's just more evidence-based studies that support the positives for women on HRT.
So you're a proponent of a medical, help. Don't white
Yeah,
knuckle it.
I mean, if you're doing all the things and you're eating properly, you're exercising, and really, really trying to do all the things, and there's nothing, you're just gaining weight, and these symptoms are unrelieved, it's time to get some help. It really is. You shouldn't suffer through it, but it's a difficult topic when it comes down to the chemistry of the body and the blood work and what's right for each person. So the question is, am I on HRT? No,
Mm-hmm.
no.
No.
I was during the height of my messiness of menopause, and I realized for me it was making me sick. And I gained an additional 15 pounds. So I did get off of it. And I feel better than ever now. I'm postmenopausal, but I take other things right now, and we can talk about that. That's
And
not directly hormonal.
that's an interesting word you use too, because it is messy. Because you're angry and you're moody, and and you can't explain why. You just are.
It's
You
like
know.
PMS on steroids, okay?
Yes, good. That's good. Because
My
my
favorite.
God, how
Yeah.
mean can one person get? I mean, and it's like, I just don't need to be that mean, but it was like so normal to be mean.
Well, the thing I hate about it is the stigma and the you're crazy now, or
Right.
life is over, or she's just lost her mind, she's out of her mind.
Or
This is,
she must be menopausing.
yeah, I mean, and we all say it. I, I know I do all the time, but it's it's also something that's really happening to women, and it's very uncomfortable. So, like anything, if someone's in pain, are they going to be nice? Probably not.
Okay, good point. Now,
We're uncomfortable. It's. Mhm.
it's all consuming. I mean, it just consumes you. Now, do you find it more difficult to manage a menopausal woman? I mean, are there special paths you have to be careful of?
When it applies to what? Because right now my primary focus is aesthetics.
Hmm, right.
And we do a light weight loss program. Some we do vitamins, peptides. That's as far as we go. I'm not doing HRT
Okay.
yet, but I am recommending people out for that.
Okay.
Um, so okay, what was the question again?
So when you say, do you treat like their facial concerns and their aesthetic concerns differently if they're in the midst of menopause?
Yes. Okay. So now we're getting specific. I do totally. When I was going through menopause, I was so bloated. I didn't really get any treatments besides a
Hmm.
little Botox and skincare. It was like I just couldn't get rid of the bloat. Now, fast forward 2 years later, postmenopausal. Last year, I got 20 syringes of filler, and this year I'm already 10 in.
Hmm.
There's a significant shift there. I went from nothing because I was really bloated to really needing volume replacement.
Okay.
Big, big, big changes with the menopausal face, menopausal body,
Yes.
mind. It's confidence. the workplace, relationships. It's a whole thing we could talk about.
But you say post-menopausal. Do you feel post that like, okay, it's over and it's done and never to be visited again? There's still some maintenance that goes on with post-menopause, isn't there?
Well, the maintenance is greater than ever, is taking care of yourself. Weightlifting, weight training, movement, good nutrition, lots of protein.
Mm-hmm.
Without those two things, we will age drastically. And then if you're, lucky enough, you can buy good food, organic food. Um, I think those are the top priorities. I put that into place when I saw myself at 208 pounds a couple of years ago for a second on that HRT, and I was like, this has got to stop.
For
I
a
need to
second. Now
help.
it just a second. That's all it was. Took a second. That was all I needed. 1 second.
It was 1 second. I let the team take full body pictures of me when I was in New York because I'm like, I need to embrace this situation. And it was shocking because I hid behind the camera from here up during that time and, just working and ignoring and taking care of everybody. So we
But
do that.
yes, we do. But you truly passionate believed it's diet, 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 what you put in your body.
I think it's more than that. It's managing your stress, it's diet, it's supplementation,
Now,
exercise.
wait, let me ask, supplement with what? Over the
Um,
counter?
Everybody can start on a good multi, a fish oil,
Hmm.
and a D3 with some K or just a D3. That's just the standard. And then menopausal, postmenopausal, perimenopausal probably should be adding in some creatinine, just to keep our muscles up with that 30 grams of protein at every meal. Just thinking that way will really support your body for many, many, many years.
Okay, fair enough. Now, would you say your Ma 81 is fabulous?
Yeah, she is.
Okay. So genetically, genetics have a lot to do with it too, right? How you pass your passage in menopause and how you age. I
Yeah.
would really be hard pressed to give up some potato chips. Can we just call that protein?
No, we can call it a gluten-free carb
Oh, okay. Because
because I eat gluten-free and that's my go-to, right?
yeah,
Mhm.
that is like
Potato.
heroin for me. I mean, it's like,
Anything, papa fritas, potatoes, anything. Hmm.
oh. And when you say protein, you mean chicken, fish, you mean
Yeah,
meat and
it's
stuff for
better
the
to
most.
eat pure food. So yeah, lean meat, chicken, fish.
And have you always been that aware of your diet, or it took going through menopause that made you more,
I'm always aware of it, but does didn't mean I applied it.
and now you're more conscientious
Yeah, because
about it?
if I don't, I really don't feel good. It's just difficult.
Really?
Hmm. Hmm.
But that takes discipline.
Well, it's a choice. Like, do I want to feel bad tomorrow or not? Do I want to
No,
have too much?
yeah, it is.
Yeah.
It's a bunch of choices we make, and yeah, you're right. And I feel like like I deserve, I
You
deserve
do.
it. Damn
You
it.
do sometimes. You should treat yourself. Like you can moderation, right?
Yeah,
And when I
yeah,
went to Argentina, I totally indulged, but really small portions.
yeah.
And
But you're Sicilian, right?
yeah, so
How,
I'm on a GLP-1.
oh,
That's
but
a
how do you give
peptide.
up the pastas and stuff? I mean, God, that's a lifeline. That's a
Well,
snack.
I could feel really sick if I eat it. Or we eat gluten-free pasta. We
You
still make
do.
bolognese. Yeah, it's jovial. I love that brand from Kroger. Hmm.
And does it taste different?
Tastes good to me, and then I don't get full like I do with the gluten. So
Oh.
I don't suffer, all night. So it's worth it to not. Yeah.
Now let me ask you too, Diane. That seems to be the new catchphrase now is the gluten. Everybody seems to have these gluten issues. Now it's like a flavor of the moment. Not everybody has these gluten issues, so they're doing something wrong, right?
I mean, it's our food source. When I was in Argentina, I ate so well, and it's like farm to table everywhere.
Mm-hmm.
It's fresh. Their resources are fresh. Their wheat is not processed the same, so I was able to eat some of their gluten. Still not a lot. It's a real thing. I mean,
Do
it's
you
a real.
have gluten issues?
I do. I
Oh,
tested
okay.
negative for celiacs, but
But you do have some
I have.
proclivities.
Oh yeah, I have a whole shift in my esophagus with acid, but I have a lot of allergies. So, and these things pop out and heighten when you're going through menopause. It's like all the bells and whistles go off. So that's what started to happen in my early to mid 40s. All of a sudden I had food intolerances.
Oh,
All of a sudden I
interesting.
had itchy skin, and I
Mhm.
was seeking, allergists, which was great. I can remember coming home and telling my husband, I can't eat anything. And he's like, no, this is good. You're going to be healthier. And it's true. So I'm seeing a lot of this with my patients too. And then there's some people that can eat a brick and they're fine, but not many.
So what are peptides now?
Peptides are amino acids. We're learning a lot about them. It's this gray space out there in wellness, but they're here to stay. I'm just dabbling in them personally myself. I've been on the GLP-1 for it'll be about 2.5 years. I microdose it. So
Hmm.
that's why I'm not skinny yet, but I don't want to lose my face.
Right,
So
right.
I'm
You
going
don't want to do
slow.
that. Yeah.
And yeah, I'm going slow, but I microdose that. That's super helpful. So that's a form of a peptide. Another one that I'm on is called BPC 157 for inflammation, healing the tissue. As I had knee surgery, I inject my knee daily with that. So there's another one I'm about to introduce is tesamorelin to my system. And by doing these peptides, these types of amino acids, actually puts the body in more of a homeostasis. So that's why I have not reached for HRT yet, because I feel pretty darn good. I don't have any hot flashes or anything like that right now, but my physicians are encouraging me to seek that for heart health, bone health, etc. Plus my skin's getting crepey, so a little estrogen might be nice. But it's a matter of I don't like to throw the whole kitchen sink at my system. Some people do.
Mhm. Can it
So
be overloaded?
absolutely overloaded. I was overloaded with too much hormones. I mean, you could look at my body. I looked like I was going to tip over.
Really?
And I felt pregnant and I was vomiting. I wasn't eating. And then I finally realized, oh my gosh, it's the hormones. I feel pregnant. So it wasn't right for me. And I was not detoxifying my estrogen properly. And some people are estrogen dominant. And, some people need a different cocktail of hormones. But that's a whole expert that should do blood work on you and really keep tabs. Yeah.
So, Diana, you can't just manage this topically and orally on your own. You have to see a medical professional to have
Mhm.
these these mixtures for you come up
For
with.
these, for
Yeah,
HRT and peptides and that,
yeah,
yes,
yeah.
yes. Your traditional physician may throw SSRIs or antidepressants at you, and or also pharmaceutical like estrogen patches and things like that. And also it depends if you have a uterus or you don't. There's just so
So
many
there's a lot of
variables.
variables.
Tons.
But let
History of
me.
breast cancer or not, there's so many things that
I think I'm
are.
misunderstanding peptides because I see peptides in a lot of face creams and all this other topical
Yeah.
stuff. Now,
Hmm.
what is the main job of a peptide?
It's just cellular health.
And you
Cellular
should,
health. It's
so topically,
it's
it's no good.
it is if you have the right delivery system. Like we just picked up a new triple peptide serum from Zio, and I can't explain it yet. Why it makes my skin look so good because it just came off the press.
Hmm.
Um, but the peptides are it's entering at cellular level. So if you think of it that way, it's not synthetic like drugs and pharmaceuticals. It's more of a regenerative wellness.
And
Um,
that works topically.
Yeah, there's many delivery systems for peptides. They can be topically, they could be orally, injectable. Hmm.
But a
Obviously,
peptide is estrogen.
No, peptide is an amino acid, and
Oh,
there's
okay.
many different ones that can help different modalities. There's so
Or-
many that I don't even know yet. I'm personally dabbling with them myself with a provider. But at Glow, we do offer the GLP-1, and we've been offering that for a couple of years, and it's been super successful.
Oh,
So
good.
GLP-1 is like the tirzepatide for weight loss management, but it also works on many other things like gut health, brain health. It shuts down the hedonistic talk of like food, or I want to gamble, or I want to shop. So on my way out the door to Argentina, I took a little shot, extra shot of that one. And when I was in there, I could indulge but not overindulge.
That's so
Like it's
interesting.
yeah, it's very, but I microdose it. So it's just going to be the wave of the future. And then with the new black label lifting for women, medical studies are here. They're coming. We're going to be managed a lot better. So,
Well,
and
this
it,
is good for the young woman today.
yeah, she's like, not for me. No.
But the young woman today has options and has opportunities and
Yeah,
stuff.
yeah.
Yeah. So, what about vitamin therapy?
It goes hand in hand with it. I think we should all be on like a base, like a multivitamin, just like insurance, right?
Hmm.
Because we're probably not eating well enough, or the intake, we just wouldn't be able to ingest that many milligrams of these supplements that we need. So I think insurance is, it's good insurance to have on board. I certainly feel better when I'm taking vitamins
You
versus when
do.
I'm not. Yeah,
You
my
do.
nails grow better, my hair grows better.
And you notice all this.
I do.
See, I guess you got to take them every day, right? You can't take them once and they taste good today, but oops, I forgot
Right,
them out. You got to
right.
be disciplined. All this stuff is a discipline.
It is, you're right. I fall off the wagon a little bit. Like I had to get off the vitamins and GLP-1 for my surgery, so I started infusing IVs a couple times a month since the
Okay.
surgery just to keep it up, and now I'm getting back into life because it's work. It's
It
like
is. It's a job, but you'll if like the chips, I certainly will find time to eat those chips and I will do it happily. Now, why
you
can't
don't
I
look
just
like it.
well, please, but why can't I just substitute that love for something healthy? It must be because I don't want to, right?
I eat my chips still.
Yeah, but
I'm not going to give it up.
you have modified your chips.
Have I? Well, so I was like, I would come home from work and have mom dinners, chips and salsa every night.
Yeah, that yes,
That's
yes,
just, I love that. So I knocked that off. I told the family, please stop bringing me
yeah.
because I will
I
just
mean,
be
the
like,
whole
these are mine.
bag of chips, now
Hmm.
that's not done. You got the bag on your head, licking the crumbs out. I mean, it can be kind of pathetic sometimes. But you're right. I instantly get home from work and I run for the carb, I guess. It's the carbs, right? It's the carbs I'm chasing.
Hmm. And if you put that protein in, you don't crave it as much. You're more stable. Your glucose is more level throughout the day.
Yeah, but Diana, where does the person who, is a junk food junkie find the convenience is the word, protein.
You don't. You got
You
to prepare
you
it.
got yeah, you got to work at it. You have to be very diligent. You have to adopt the my body, how is that temple, my body is the temple or whatever
Hmm.
mentality. I mean, you have to be very disciplined about it. Do you think, Diana, because you practice these disciplines, you'll live longer, healthier?
No.
You don't.
I'm
It's
kidding. I
okay.
live hard and fast. No, I'm just kidding. I do not. With work, I feel like I live hard and fast and traveling. But no, like you were saying, my mom's 81, but she's always worked at her health.
She
She's taken,
has.
yeah, she's taken very good care of herself. Now, my father, on the other hand, I lost him when I was like 28 years old because he did not take care of his health. He was 68 when he passed away from diabetes,
Oh,
and it was
yeah.
basically poor nutrition. And his nutrition. He didn't, smoke or drink. So Yeah, it is genetics. I could go either way. And during menopause, I thought I will become my father if I don't knock this off right now.
You did. So you had that conscious thought.
I got really, really scared because I had this false, not really false, but when you have hormones, you have a little more protection as a woman, from a cardiovascular standpoint.
You
And then
do.
you do. And then when you go through menopause and you lose those hormones or they become lower, your risks are much higher. And that's why they're suggesting HRT. But yeah, I mean, it scared me. It scared me because
Well, let me
I,
ask you, Diana. I mean, if you notice, every single elderly woman has the same body,
mhm.
no ass, big belly. Why is that? Why do we morph into that shape?
Well, when our estrogen drops, our metabolism just slows down. Like it just slows down completely. Um, you become more insulin resistant, like we were just talking about. Like I was really afraid, and when I was going through
Hmm.
menopause, I'm going to become a diabetic because all these things are going against you. You're not as efficient, um, and and the weight gain just starts to settle right in the middle.
Right. Okay. Yes.
Right. So we're losing the fertility hormones, the luscious hormones that make us voluptuous and sexy, and now we're becoming shapes like old little men.
Right.
Like
Yeah. For
skinny legs,
real.
skinny
Yes.
arms,
Yeah.
and
Yeah.
it's all
Yeah.
going in there. It's just totally insulin resistance is what this is what's happening, and that's what I'm saying. Like the peptides, like GLP-1, or really helps that resistance.
So you don't necessarily have to have that.
No.
Lar- you don't if you manage it with these components.
I have patients on GLP-1, whether they're microdosing or they're on a starting dose or a double starting dose, everyone's unique there too. At that are at ideal body weight, but their A1C was over 5, which didn't make sense. What is it? What's happening? Is she overly stressed? Does she have a lot of cortisol? Because she has a doctor friend. I'll just tell you that. And her body's perfect.
Hmm.
We put her on a bit of a GLP-1, and she's just more efficient, more efficient. So
And when you
it's
say efficient, what do you mean? Is she's efficiently
she's
burning?
not, well, yeah, correct. She's not as resistant to insulin. Her body's processing the sugars better. Her A1C is now normal. And this is actually like a perimenopausal woman. So it's just interesting to see how we can change our bodies, with the right nutrition and the right tools. But
That's
it's
so
not overnight.
interesting.
It's not overnight.
No, no, it's a
Yeah.
discipline. I mean, it's something you just got to do and adapt it and do it the rest of your life.
You have to reset your body. There's some non-negotiables for that menopausal body. I mean, and again, it was like eating protein. So 30 grams of protein with every meal, making sure your water is just as important. The weightlifting, that's a non-negotiable.
Hmm.
If you don't want to have that menopausal body, right? So strength training like 3 to 4 days a week, and you can shift it. I haven't yet. I'm working on it, but I'm getting there. It's just
So, have you always weight trained, or is this a new
off and
something?
on, off and on. I've had some injuries over the years, like neck, knee,
Hmm.
shoulder, back, that kind of stuff. That's why I'm off and on. But now instead of being off and on, I'm just on, and I adapt to the movement that my body can do at the moment. Because just because I had knee surgery didn't mean it was over, right? It's just a mindset.
So, Diana, do you have a hard time just laying on the couch? I mean, you seem to embrace new things and you're very enthusiastic about learning, learning, learning. Do you do you ever just do nothing?
Yeah, all the time.
You're
I
so
I
full
have
of
my
shit.
down days. No, I mean at
You
night.
feel guilty when you have the down days?
No, I need them for reset.
Oh, all right. Okay. So you give yourself permission to
Sometimes,
just,
sometimes I don't. Like if sometimes if I lay around too much, I do feel sick. Like, am I sick? But I don't, like it's not ideal. I wouldn't say, "Hey, come over on a Saturday and let's lay down and watch Netflix all day." That's not my
right,
ideal of fun, I guess.
right, right, right.
Really boring, boring. I'll fall asleep. I put the TV on to fall asleep.
Yeah, no, I sleep with it on too. I like it on, but please believe me, I can waste some time.
Hmm.
Where I'm laying there so long, I was like, wow, I think I've grown into this couch a little bit. But it's just so respectable that there's learning, more and more learning, and you're very enthusiastic about it. Does the menopause just come now? It's here, it's over, and that's it. I'm tired of everything. I'm done.
I could do that very easily. Did you feel that way?
Well, I'm never adapted. I mean, I'm a different kind of generation where none of this great stuff was promoted for me. And I probably shouldn't say it out loud, but I don't remember having a very challenging change. But I had a very easy period. I hardly
You're
had,
so lucky.
yeah. I mean, other than maybe some headaches and mood swings, but I didn't like lose my hair, or I didn't have any of those. But I didn't have a horrendous menstrual cycle either. I don't know if those go hand in hand.
Yeah, it sounds like you're pretty even keeled,
Yeah, I didn't never had a
well
terrible.
regulated. That's awesome.
Yeah, so I sort of, unbeknownst to me, I didn't even realize that I was cycling. Really.
Oh, really?
I mean, other than getting mean, and maybe I just thought that was my normal disposition or something. And my period just stopped one day.
That's awesome.
Yes, I mean, but I am not. I probably could be better to myself, about eating better and exercising more. And I'm taking my good health for granted, maybe. Maybe I should be more aware.
You look gorgeous and
Well,
healthy,
you're
like
very kind.
doing all the things.
I need to be, yeah, more conscientious of things, probably. I probably should, because I am, Diana, taking it for granted that I can still stand upright, bend down, go up and down stairs. I'm on no medication, you know what I mean? So I am sort of taking it for granted, and
That's
it
awesome.
it probably, I'm not going to give it no energy, but it might not last forever. So I should start doing stuff now,
Right.
you
Yeah.
know?
Start with a multivitamin. It's that easy. Start
Yeah,
with better
why can't I?
nutrition.
And I have them.
I just feel better when I do it.
I
So,
don't feel any different. Do you
really?
drink coffee?
Yeah, but I'm about to go all into like a 30-day or 40-day detox
Why? Do
because
you think the coffee is bad for you? Is it bad for menopause?
I don't think it's bad for you. And I do drink organic coffee because I'm concerned about the chemicals, but it's ripping me up, the caffeine. So I'm
Oh,
doing it for health reasons. And damn, I don't want to give it up. But I started switching. Like when I go for something, I don't just. So I start drinking tea to wean into the process. So my body's not shocked, but I
oh,
can.
okay.
But
So
no,
it's
if you're
is
fine
it
with
the
it,
caffeine you got addicted to, or you just love coffee?
I love coffee. I love the smell of it. I love to start my day, but I can go without it.
You can. You don't
Yeah,
get headaches or anything like
no,
that. There's no physical.
no, not for me. Not with the coffee, but I love it. But my body is not, it's saying no. My body is just signaling to me. Your body's not signaling, so just get on some maintenance. That's amazing.
So do you think you're done with menopause?
I don't know if you're done. Like I have patients that are in their 60s and they're starting to come to me with, we talk about our ailments in the beauty room, the treatment room, and I see women that are still going through maybe a lighter menopause in different times through their 60s. Like my mother's 81, still having a hot flash. You've been pretty stable your whole life. So, everybody has a different experience, just like a birth story. And it's nothing different with menopause.
Now, if you could, let's just say menopause is a character. What kind of character would it be for you?
Tasmanian devil.
Wow, that was like you waited for that question your whole life. You had that
I
answer
know.
already. I mean it, man.
I
I
didn't
thought,
even know you
oh,
were
this
going
is
to
going.
ask
She's
me
going to have
that.
to think about this, but you had it ready.
Mm-mm. It was just
Wow.
natural. It just came out.
So I hear there's like gluten-free beer and gluten-free wine. Now, do
Oh
you have,
no, I'll drink the beer.
you will
Georgie,
drink?
my dog's getting Georgie, come here. Yeah, I'll drink the beer.
Oh, okay. No,
I'm
what
not that hard pressed, but
now gluten-free wine? What about that?
I've never tried it.
Oh, and they make gluten-free vodka and everything now. I mean, they're
Really?
really, yes,
Well, some vodka's potato based, right?
yes,
I
yes.
think.
Yeah, they all are. Yeah.
The one
So,
thing I can't do, what I used to do, is drink wine. Can't do it now.
but
Creates
they,
hot flashes.
oh, really?
So I really haven't had wine in like 2, 3 years.
Now, is wine good
So,
for you?
I mean, it's good for you, but probably not, 1.5, 2 glasses often. It's
Right.
not that good. You're better off taking a vitamin. It is alcohol. But
Mhm.
there's antioxidants and resveratrol, all kinds of good antioxidants in it. But at the end of the day, there's sulfites and creates inflammation and blah blah blah.
And then that's bad.
Right.
Now, do you have trouble sleeping?
Not anymore.
The little Tasmanian devil is gone now?
She's gone. She's
Gone.
stable.
Okay. All right. Damn. I was like,
No, she's
hey.
here. She's still here.
Oh, okay. All right.
Oh,
But you sleep.
I do now. I didn't. I actually sleep better now than I did through my 20s, 30s, 40s.
And why do you think that is? Because you're taking better care of yourself?
I don't know. Or the hormones are just,
Are
I'm
you
just more in.
exhausted?
No, I
You're
feel
not.
really good. I mean, I might be right now. It's Friday and I just got back from the gym. But no, I feel really good. I'm really good.
You do. Okay, that's
That's
good.
probably why I'm not seeking the hormones. But at 53, it's something I should really, and anyone in your 50s before 60 should probably seek it at some point before it's too late to really benefit from them.
So if somebody asked you, what should I do for my menopause dilemma? Would you have a menu for them?
I wish I had that provider in my office
Mm-hmm.
to offer that, but I don't. So I would actually refer them to somebody, but we do the weight loss. Starting there really can get your hormones back in the right place too. So searching for hormones as your first step probably isn't your best step. The basics again, with nutrition and movement and going from there.
But Diane, let me ask you, this seems like this path is for the affluent. What if you're just a poor little person trying to manage this?
Well, still making good nutrition choices, movement, keeping your stress down, getting good sleep, taking a multivitamin. Maybe you don't have access to peptides yet, but the GLP-1 just became, I think, affordable across the nation.
Mm-hmm. Yeah.
So there are ways to do it budget friendly.
That is an amazing drug.
I
Was it
know.
being withheld? I mean, it's just an amazing drug. It crosses so many boundaries. I mean, it's just, why wasn't that distributed a long time ago?
Big business FDA stuff.
That is crazy.
And the company Lilly. I mean, there's so many lawsuits going on right now, and but now it's affordable to all at the moment, I believe. So it's always changing. It's a gray space, but it really should be there available for people.
Yes, because it's not just the weight loss thing. It's so diverse.
It is.
I mean, it just, and now it's like a godsend.
I wish my father had it.
Yes, right?
Yep.
So
Yep.
do you think obesity and diabetes was becoming like very normal, very accepted?
I think it is, right?
I mean, it just
I don't
seems
know
to
that.
be everybody has got high blood pressure,
Right.
diabetes, and they're a little heavy. It just seems
Normal.
why? Why is that? Is
It's our
it diet?
food. I think it's
It's food. It's
our
a
food. Like,
simple.
I could get really gross. We went to Argentina. I ate the food. I mean, everything was fresh. You order soup, it's fresh pumpkin soup. When I was there, my bowel habits got better.
Mm-hmm.
Came home solid. Every day was a solid home run. Now I'm back home and it's not. It's the food source is so extremely different here.
That's so interesting. Do you think
Hmm.
that's on purpose to keep people sick?
I hope not.
I just wonder sometimes, is there a bigger
Yeah.
picture? You
Well,
know?
it's always, I think it's always about money. You know, cheaper
Yeah.
soy is a cheaper protein source, agriculturally. You know, you could go on and on in the way they denature the wheat. It's all, you know, for profit and big sustainable food that we can put on shelves that don't rot. And that's not normal. It's just not
It's really, I
natural.
mean, it's such a good point you make because I remember being, little and the produce guy going down the street, and that was a very mainstay of your diet until the processed food and the fast food became the norm, and then
Right.
all of that got pushed to the side and the produce man wasn't coming around. I mean, you ate produce. I mean, the guy came
Right.
by and you had your fruit and your vegetables and whatever every day. But there's no like now produce, you go to the produce store and they've got it, exhibited so beautifully and it's expensive.
It's so expensive. I know. Groceries are so expensive.
Yeah, so then you find yourself taking the path of past, processed, by but it wasn't always that way.
I know. I grew up with, you know, easy TV foods and was we were getting into
But
that.
think about when you grew up too, Diana, where there weren't a lot of heavy people.
No, everybody was skinny except for my, you know, Italian family.
Yeah, but not even they weren't even heavy considering by today's standards
Right,
heavy. You know
right,
what I
right,
mean?
right.
They everybody was smaller. There weren't any real heavy people, but they died young anyhow. But I just think this menopause is such a Tasmanian devil and it's evil. And I think women aren't given all the information they need,
No,
and like you
they're
said
not.
earlier,
We're
they're
just
just white knuckling it.
it is a white knuckle thing, and but there are tools out there. There is awareness. The government has now, you know, we got the government's attention. The black, this is huge. It's huge, you know,
Yeah.
that this black label warning box has been removed. So, and it's opening up physicians' eyes. It's a movement in science. So,
Do you think, Diana, this, like you're saying, the specialized hormone to your body would be more well suited to a female doctor?
mm,
Her understanding of it?
yes,
You do.
I do.
I do too.
They go through, I mean, I understand my patients when I go through something similar. Y-
Yeah.
y- Yeah, I
But
do,
I
unless,
find
you know, it's
I find with you, I like when I'm doing something with you and you have told me you've done it, it's like then I then have permission to go ahead.
right. Well, you trust the person. It was like
Yes.
when I worked labor and delivery, I started in the early 2000s and I wasn't a mother yet. And I had no respect for my patients until I had to prove that I was a good, you know, nurse.
Hmm.
And then once I got pregnant and had my daughter, it was a totally different dynamic in the room. You know,
Yeah.
you
Yeah.
so you relate to people
So
and
that's why I think having a woman doctor that's now dispersing this very specific hormone is better than having the male doctor.
unless, you know, there's some men out there that are passionate about wellness and health, and I don't want to knock a man in that position. But even to the woman provider, they have to be good. They still have to be good at the end of the
Yeah,
day.
that's true.
They
That's true.
need to be passionate about the topic. They need to stay cutting edge into the research, you know, evidence-based science that's coming out now, and it's a big undertaking. That's why I need someone special in my office to help me with this. It's cool though to that the aesthetic arena is going into wellness and it's really going hand in hand. So it's kind of becoming normal. Hey, I'm going to get my Botox and my peptides, or
Right, right. But
yeah,
can you get peptides injected in your face?
they have intraceutical treatments. Yes, not it's off label to inject peptides into your face or exosomes, if you will. Um, but there are intraceutical treatments out there for topicals or to use with like puncturing the skin like microneedling.
Now, do you advocate for that
Yeah.
at home? Do you advocate for those home?
No, 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 I don't. Because you could introduce
You can.
bacteria or
Okay. All right.
infection. I don't know what the tool is or what it's made out of or
Oh, all right. Okay. I was going to ask you something. I forgot what it was. I can't remember. It was good too,
it was
whatever it
good.
was.
It'll come back.
It was so. My dad used to say, "Don't let your mind wander too small to go out alone." What was it? It was good. What when you do that blood thing, is that a good? It's good that your office is doing a multitudes of things.
So the blood thing we've been doing a long time, probably the past decade, and we just keep spinning it better and better. Like we're not spinning just PRP anymore. We're doing easy gel and platelet rich fibrin matrix and but then at the end of the day this substance that comes from your body is only as young as you are, okay? So that's
Oh,
where
that's so
yeah,
interesting.
so I do a lot of those procedures for the people who are maybe wary of inject other injectables and that, but it's going to take a series of them. It's more organic. It's not going to be as robust. But we can certainly pair them with other things too as we get more confident. But in the arena of aesthetics. But yeah, so I
So,
like to pair like exosomes with my blood for hair restoration. And
is that a topical?
um, it is a topical, but we puncture it in the exosomes, and it is wildly successful. And
It
I'm
is
still.
stinking crazy the
Mhm.
stuff.
I know, I know. There's so much out there.
So let me ask you, if some young woman came to you and she was premenopausal, what advice would you give her?
I mean, it's always, I'm going to say it again, the
It's
basics,
you're just gonna
the
say exercise,
non-negotiables.
diet.
Water, reduce your stress. I mean, but that's really the hard work. That's the hard work that has to take place.
So how do you tell somebody reduce your stress? I mean, what is it, a breathing
If
technique or?
someone told me to reduce my stress, it'd be like, shut up,
Yes. Yes, absolutely. Or like what stress? Some people don't realize they have stress till stress is gone.
Right. I know
You
there's a
know?
lot. Even me, like going back to the gym after being out with my knee, I told my girlfriend who owns the gym, I'm like, wow, these workouts are making me very aware of my body and
Mhm.
what I need. So it's a lifestyle.
And will you push it, or will you just find something very comfortable and just stay there, or will you push it and go to the next level?
So my younger self would push, 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 push.
Right.
I'm more like postmenopausal for me has been eye opening and I come from a traditional, sort of traditional family, not huge, but and when you come from this traditional setting, you feel like you're a peacemaker, a caregiver, all these things while sustaining work and raising kids and a house, and you get to a point where you just can't do it all anymore.
Mhm.
And that button that happens where you're just like, F it all, man. Boundaries are starting to go up. I'm realizing if I don't take care of myself, this won't continue. It's not sustainable. I don't know if you've ever had that aha moment, but I like being this age.
Oh yeah. Oh yeah.
It's
Do you
wonderful.
do you think? Yeah, you know what, Diana? I said this the other day, and it makes me a little angry at women. why why will women like grow their hair just to wear it in the ponytail, never put any makeup on, and just walk around like a big frump? And I mean, I'm not trying to be ugly here or anything, but I realize it doesn't take a lot of time. What headspace are they in?
Midwest, suburbia. I don't
But
know.
I mean,
Maybe they use these. I
why,
don't know.
why,
As I'm
why?
looking at me in my workout clothes.
No,
Mhm.
please stop it. But I mean, you know what I'm saying? That seems to be more the norm.
It is, but if you travel, it's not.
Really? So
Yeah,
on your travels, you've noticed women are really taking care of themselves.
Yeah. Yes.
So
Fashion.
you find it kind of
Beauty.
exclusive to the States, maybe.
Hmm. I do. I mean, it's our normal, right? But then I live in Rochester. I work in Rochester, so I'm in a Rochester bubble. So I see a lot of really well put
Yes,
together
yes.
people. And
Right.
um, then when, you go to the grocery store, it's like, oh, okay.
So do you think confidence is often mistaken by before arrogance?
No, I think arrogance is arrogance and confidence is confidence.
So you don't think the two can be mistaken for each other? You know, like some woman will look at you and go, "Look at her, who she thinks she is."
Yeah.
You know what I mean?
But that's a reflection of that person.
Well, that's the mature answer. Absolutely. Yes, absolutely. Yeah,
Oh man.
but yeah,
Okay. So yeah, I think yeah, I get what you're saying. I think a lot of men may think that the perimenopausal, postmenopausal, whatever woman that is confident could be arrogant. Right. Yes. Is that what you're getting at?
yes, yeah,
Yes.
yeah.
Hmm. Why is that though? It's a reflection of
What?
themselves.
Yeah.
They're not confident. Maybe
All
they're
right.
lacking something, right?
Okay. Yeah.
I
I
don't know.
mean, would you think to just go out and I have done this, I'm not above it. Have you go out in your pajamas and your slippers and shit and just, it
I
is.
do all the time. I don't care. All the
Here's my stupid ass. I'll go out in my pajamas and my slippers, but oh my God, I'll have my makeup on.
You're so cute.
I
My
will have
husband,
clothes on with paint from 10 years ago, but I'll put a nice coat over it.
exactly. I mean, it's the whole philosophy, don't leave your house with bad underwear on. You
That's
know, what
exactly it.
happened?
And I got some underwear. I don't know what hole to put my leg through
So
anymore, but
then just don't wear any underwear.
oh,
That's
okay.
better. You should
You
see
know
what they
what? You
do in the
talked about
ER.
that bowel movement thing. You got to have the barrier.
Yeah, that's true.
Gotta
Especially
have it.
especially postmenopausal, right?
Yes.
Talk about having a pea cup in your garage. You know?
Oh, that's funny. That's the thing. That's what we've all been through. Nobody talks about it.
No,
Nobody talks about it. You
we
think you're
talk
the
about it
only one.
all day in my office. All
It's
day. I love
yeah, but
it.
you got these young, beautiful, vital gals in the office, man.
What are
You
you
do have a
talking
good time
about?
in that office.
We do. Oh, we do.
You do. You got a good crew.
It's a good crew, but Lindsay, who's been with me since the beginning of time, she started with me in her 20s. She's only like 35, 36, maybe. This poor girl has been in menopause with us since day one.
Well, that's
They
too
all
bad.
hear,
She's
no, but
scared. You scared her,
yeah,
man.
no, they all hear about it. But
Yeah. Well, at least they have the advantages, though, and they have the opportunity to take advantage of it.
mhm.
You
I will
know,
tell
and
you, I exactly. I
you know,
exactly. When I my last travel that I went on was Atlanta, Georgia, and I trained with Dr. Mar, the Dr. DeMaio from Brazil. It's specifically MD codes, and I'm really into it because of the pain that I've experienced with postmenopausal facial loss, volume loss. So the MD codes is the way I was originally trained to restore faces, but I'm amping it. And Allergan bought his program, and I can't believe how successful and natural it's looking.
and
Um,
is that the goal, though, Diana, to look natural? What do you do when you get the gal that comes in there and wants that universal big lip? Will you slow her down, or will you say, I don't do that kind of work here?
I mean, I break up with them before they even know it. It's just
Oh,
like
you break up with them. You do? So
I
you have a
try
very
to.
subtle way of saying, I'm not a good fit for you."
Yeah, if they come in that way, I mean, now I've been doing this a while, I'll just immediately say we need to start over, or especially if I see migration or something aesthetic, I just explain to them like facial ratios or, and if it's an aesthetic preference, then we quickly realize we're not a good fit. And it doesn't happen often because you attract who you are, right? So
No, yeah, yeah.
I attract people really that just want to be fresh, look vital, don't look fake. But yeah.
Yeah, you're not a proponent of that. Although you've had how many injections? 30 in your face, but it looks so natural.
Yeah. And I need more because I mean I'm really
That's
struggling
just
with
great.
the
But
weight
here's the thing.
loss.
I so respect that you put it out there. You're not trying to hide behind some veil of beauty. I mean, you put it right out there, and I think women should do that. We shouldn't,
Yeah.
let other women think, but look at her, 80 years old, looking so good. Tell the truth.
Tell the truth. Yes. I actually have on the books for I lift procedure and a breast reduction for December 15th with Dr. Sherbert, but I'm going to cancel it because the knee surgery was so intense and it's the holidays, but
Yeah, you don't want to do
things
that.
I know my husband said, please, what are you
Yeah,
doing?
not before the holidays. Enough. You
So
can
next year.
wait. Yeah.
Next year. But I mean, it's just a matter of did I ever think I would want to have
Now, the breast
surgery?
reduction, is it because your breasts have become just an albatross, or is it a cosmetic thing?
They've always been
Big.
an issue.
Yeah.
Yeah. And
Yeah.
I told myself I would do this one day in my life. I don't know why I waited this long, but sort of want to get my body stabilized. Like,
But because you want to wear the bikini, or it's not that
no,
kind of vanity?
oh, no.
No. You
You see
just want,
that? Do you see that?
yeah, okay, your bras are digging in and everything. Now, your eyelids, is it because your eyelids are droopy and you can't read like you'd like to?
No, it's because I want to look forever 39. Okay.
Oh, that's the number? Okay. Okay. I,
No,
I
no, it just,
respect it, man. Yes.
after menopause, things have just changed and you just see little differences. And mhm.
I
Look at
like
your
it.
eyelids are fabulous.
I got
And
like them big, and I got these humongous ears and stuff.
no, you're so
I mean,
cute.
my
You're
little
like
ears. I think people
Tinkerbell.
are waiting for them to start flapping so I could fly around the room or something. But yeah, no, I got lucky that I got those big bulgy eyes because they age decent.
It's nice.
But no, I mean, I'll be there to see you soon. I mean, you got a lot of good stuff going on there, man. I think I could just bring my little sleeping bag. Here's
Yeah,
the beautiful
perfect.
thing. You're so smart here. You have a credit card system.
We do.
That is brilliant.
I mean, financing.
Yes, yes. That's what I mean. Yes.
Hmm.
That is so smart.
It just helps
Because for
people.
someone who just wants to, try a little something, they can.
Yeah, absolutely.
You
Yeah.
know?
Hmm.
That's great. All right, Diana, you want to close up this menopause thing and your Tasmanian devil with what?
Um, let's see. What are the non-negotiables?
Yeah, well, you already know
No,
it's the
you
work.
tell me.
Well, it's vitamins, protein, weightlifting, potato chips.
Yes, it must.
It's a
Beer,
must. Well,
beer,
and
beer.
beer, yes. And these other, I don't need any of those other medicines just yet.
No, but when we can talk.
We can
Get
talk.
a
Yeah.
multivitamin is just it's insurance.
But I've been taking the B12 too because I read somewhere that
Okay.
tell me the name of it, pernicious anemia,
Per-
pernicious, and the how do you say it?
Perniscus?
Yeah, the B12 anemia.
Yeah.
My
Do you have
dad,
that?
I heard that was genetics, and once you become deficient in B, like your brain gets mushy and stuff, and you can't reverse that.
Are you getting your blood work done?
No,
Your
I
blood
don't. I tell you, I don't go to the doctors because I don't. I'm healthy.
you're healthy. But you could check your vitamin levels and then supplement appropriate.
Right.
Mhm.
I do take the B's. How do you say the word?
Perniscus? Is it perniscus?
I think you're close, but you ain't there yet.
I just got over COVID, so I'm really
Yeah. Oh, excuses. But anyhow, that's the anemia he had, and I think his mom might have had it. So I think that's maybe a predisposition or something. So I take the B's.
That's
I
good. I
take the
do
B's.
too. I do too. It was actually shocking. I had blood work done a couple of years ago and my B was really, really low.
Yeah, I think B's are
Yep.
very important. So,
Mm-hmm. Yeah.
all right. Well, I just think women need to realize we all go through it. All these things that happen to you are not just exclusive to you. Everybody, and talk about it. Just talk about it because it doesn't have to be miserable. Don't like you said, don't white knuckle it. Just talk about it.
Right. It's like every topic a woman goes through. I feel like my generation is better about talking.
I think
Um,
so.
Even through through life, like the periods, the cycles, PMS, pregnancies, miscarriages. I mean, this is something that just doesn't have. Hormones are a lifelong tweaking situation, if you will.
And do guys have any hormonal challenges?
Yeah, for sure. I mean, their testosterone starts to go down as well, and mm-hmm,
Do they
mm-hmm.
get cranky and miserable and
Yeah,
backaches and lose their hair and
yeah. They just do it like a decade later, right?
okay, yeah, all right. When
I
it's
mean, it starts.
attractive. Yeah.
It's all. It's not just one day. It's a magic button. You're in andropause. It's the same thing as menopause. It just decline, like the aging process.
But like you said, we are making progress.
We are, instead of it being a disease, I mean, we can treat it and have
Yeah.
longevity and wellness and yeah.
Yeah. All right,
So
my friend. Thank you. Thank you. I adore you.
go get your vodka and your potato chips. It's Friday, y'all.
I'm gonna go get my chips.
I'm so disappointed. I was going to take a shower, curl my hair, and here I am again.
Oh, will you
But
stop
oh
it?
well. But you know
Yes,
what?
stop it. What?
This is a topic. So I had one of my studio people in from the channel,
Mm-hmm.
and we were talking about gray blending because this is gray blending, right?
Right.
This is all my gray hair. So I think at this age it's going with what you have somewhat or elevate it, right? Instead of covering up everything. Um, for menopause and aging, I don't know.
No, I agree. I think it's a good point. I think women are so afraid to be gray.
Well, I don't go all gray.
Well, no, not ugly,
Just
but
making it easy, like
but it
maintainable.
can be so attractive. You
Can
know?
some people, right? Yeah.
Yes, yes. So
Okay, I
do
got
it.
something to end with
All
because
right, here we
this is
go.
this is really powerful.
Drum roll.
It's just I just want everybody to hear this. Okay. A confident, grown, self-made woman is the most intimidating thing in a room. Not because she's aggressive, not because she's loud, but because she's untouchable. You don't need to do anything to prove yourself. Your existence already does that.
But that confident, wonderful woman will be hated by all the other women in the room. We do not support, we are not each other's allies. We hate each other so often.
Yeah, it's a really competitive world. So,
Yes, and it shouldn't be. If you think that
mhm.
woman's got some great shoes on, tell her.
That's right.
You know
That's
what I mean?
right.
If you
Hmm.
think her hair is wonderful, tell her. Don't whisper behind her back going, who does she think she is? We are just bad like that, Diana.
It
We
can
are
be
bad.
very mean, but it can be very wonderful too.
But we have to unite and become an alliance because we have to stop that. We really do.
Yeah.
Because like you said, that confident woman will command that room, and all the other women that aren't confident are talking about her, and it's
But
okay.
but the
It's
confident woman won't give a shit
right. It's
because that's just
okay.
a self-reflection of them.
Right. You always go back there, and
Because
it's
it's so
true.
eye-opening when you
Yes.
when you observe behaviors and you realize it's really not
But
about behavior.
doesn't some behavior just piss you off? I get so pissed off, and it's you know um, at other
Yeah.
people, and I shouldn't let it bother me.
Yeah. How about walking into a gym? Oh my gosh, this is so bad. I can't even tell you because this is yeah. I'm doing a B2B with a gym and I adore the gym owner. I adore her. But his
Mm-hmm.
partner was sitting there. I walk in and he's getting an IV from another med spa. And the first thing he says to me is, "Your competition's here."
Yeah, what are you supposed to do with that? You know?
I laughed.
Well,
I said,
yeah.
"Oh."
But I mean, why was it necessary to say
I
that?
don't know. But what I will tell you is when a confident woman walks into a room, right?
Yeah.
It's a self reflection of that person.
Okay, it's true. But you have to be, like you said, confident being the working word here. You have to be very confident to realize the other person is inadequate, that their problem is not your problem, which
Right.
takes confidence.
Right. And that comes from self awareness, eating your protein, taking your vitamins, weightlifting.
Wait,
I mean, like we
okay.
talked about, if you're running around your jammies and your hair's like this every day and you have no makeup on, you're going to feel like shit.
You're going to feel that way, I think.
Yeah.
I agree. I think you have to present some sort of
I
way.
spend a freaking hour and 20 minutes every day, not today, blowing my hair, putting makeup on before I go to work.
But would you not do it? Would you have it any other way? You would do it
Yeah,
every day. Oh, you would
I've
not do
I've done it. I've come in that way too, but I just think that ritual in the morning is for me.
Right. It's not
That's
for
my
somebody else.
it's my time to take care of
Yes.
myself, to rub the lotion on, to take care of my skin.
Yeah,
And
I
that's how
agree. I agree.
and then the whole day just sort of runs better.
I
It runs
agree.
a lot better.
I don't put it on for nobody else. I put it on, and sometimes, with my vision, I'm not getting it on right where it's supposed to go, but I
Well,
get it on.
that's a blessing. This visual thing is it's for a reason.
And I get it on there, boy. Yep. But my
I
cousin told me one time, Diana, I'm sorry, I didn't mean to interrupt, but he
no,
told me this was so good to me. We were talking about rude people and, well, what bothers me, and I had a list, right? And on my list, it was like when you go through the door and you hold the door for someone and they don't say anything to
and
you,
that's not nice.
that's not nice. But he said to me, if you're holding the door because you want them to say thank you, then don't hold the door.
Yeah, those are expectations that
I
you
was,
just may
yeah,
not
I
want.
was like, well put,
It's
it was the
managing your
simplest
yep,
formula.
I
Yeah.
know. There's so many easy formulas. It's just it's practice, right? Like so yesterday when I walked into the gym, like my insides, I emotionally was charged, but I didn't
Hmm.
want to show it. And then I go to my friend who's the other owner and told her right away, and she's like, she got emotionally charged. And then I realized, no, no, let's not go there.
Yeah. Yeah. Right.
But
But
it's
yeah,
hard.
but it's good to commiserate. It's good to have girlfriends to commiserate with. You know what I mean?
Mhm,
And then when you get it
mhm.
done, you feel better that you're not all alone.
Yeah, as long as you're not dumping too much.
No, 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 don't dump.
Yeah,
No, don't
yeah,
dump. Just, yeah. So, all
yeah.
right. I liked it. And even though we injected a whole new dialogue into your closing, it was good. And it rings true. It rings true.
I
Because you
feel like
will
we all just
always,
like, yeah.
yeah, you will always notice the one woman in the room that stands out.
Or the man, right? They have this presence,
That's true. Very true.
right? And he could
Yeah.
be not very cute or very tall,
Right.
but it's just this presence.
No, true, true.
Hmm.
So,
Confidence looks so good on everybody.
right,
It's just
right.
hard to,
And it's an attitude. Confidence is an attitude.
but you don't have to be a bitch. Like, you
You
don't
don't
have
have to be arrogant. You don't be
right.
arrogant. That's the confusion.
Yeah.
So, all right,
Well,
Diana, what are you going to do with the rest of the day?
we're going to dinner tonight with my husband's business partners. So I gotta shower, get cute, walk the dog, go talk to my daughter. She just got home from nursing school.
Oh, good for her.
Yeah.
Is she still doing facials at the salon?
She's doing them on the weekends now. So
Great. Oh,
yeah.
yeah, in closing, just give an address and a phone number and a shout out to your business.
Okay, so it's Glow Aesthetics in Rochester, downtown Rochester, Michigan. It's on Walnut. No, is it? Yes, it's on Walnut. 202 Walnut, Rochester, Michigan. Glow Aesthetics.
Yeah, go there. Go there. I mean it. It's a great place.
Aw, thank you.
All right, next time we talk, we're going to talk about cartoon characters like the Tasmanian Devil, Wicked Witch of the
Okay.
West.
I can be witchy too sometimes, yeah. So
Oh,
if we're
yeah.
gonna do Tasmanian Devil, then I'm gonna come totally air dried.
Okay, there you go. Okay. All right. All right, I'll see you soon,
Awesome. Have
hopefully
a good
before the
weekend.
holidays.
Yeah, sounds good.
All right, say goodbye.
All right. Bye.
Bye.
Ciao.